So here we are, folks, once again. Flu, COVID, RSV, and all the other upper respiratory viruses are here in full force. Our emergency room is swamped with patients feeling miserable and looking for the magic pill that will take away the hacking cough, sore throat, runny nose, and so on. Hi, I'm Dr. D, and in this video, I will go over several very effective strategies to help you recover faster from the miserable symptoms of common cold. Now, I'm sure that most of you know that flu, COVID, RSV, and the common cold are all caused by viruses. Unfortunately, we do not have a great way of treating any of them. Antibiotics have absolutely no role in treating these, and good doc will not prescribe you antibiotics to treat any of them. Why? Well, simply because antibiotics don't kill viruses. Antibiotics are very powerful weapons against bacteria, but not viruses. I hear you, doc, but what should I do? My cough is so bad that I can't sleep at night, and my sinuses and sore throat are killing me. Don't you think I need antibiotic? Well, there are indeed some instances when some of the symptoms of the common cold, such as cough, sore throat, and sinus pressure, can be a manifestation of bacterial infections, such as strep throat, acute bacterial sinusitis, or pneumonia. But these are rather rare. When that happens, most people are usually quite sick and know to go see their healthcare provider because it just feels quite different from how they usually feel when they get the normal common cold. But again, in most cases, all the symptoms of upper respiratory infection, such as the nagging cough, sore throat, sinus pressure, or even the ear pressure, are the result of viruses and not bacteria. Now, we do have some antiviral medication for flu and even COVID-19, but their use is either limited by the severity of the illness or their effectiveness. What I mean by that is that we don't give every patient who tests positive for flu or COVID-19 automatically the antiviral medication. When it comes to flu, contrary to what some health gurus will tell you, the effectiveness of the medication is better on paper than in practice. What I mean is that it is well-known fact that the medication for flu will decrease your symptoms by average only by 1 day. So when I look at the price tag for this medication, which even with health insurance coverage can be quite high, I'm just not sure that it's worth it for a generally healthy person. Now, the situation is a bit different if you fall into one of those high-risk groups that can get seriously sick when getting the flu. For this group of patients, this medication can actually be quite helpful. Now, keep in mind though that the effectiveness of the medication drops the longer it takes for the patient to start taking the medication since the onset of the symptoms. In general, we rarely give the flu medication to patients after initial 72 hours of symptoms. So what it comes down to is a basic fact that our body simply has to wage the war with the virus on its own. But wait, that doesn't mean that there is nothing that we can do to help the body fight the virus. In fact, there is a lot we can do when it comes to managing the symptoms. You can use traditional allopathic medication that your provider can prescribe for you, but even more important are several natural strategies that you can employ to support your body in the fight. Today, I want to focus more on the holistic approach to managing the upper respiratory infection. And best part is that you actually have most of the things that I will mention today already at home. So let's start with one of the most important principles, and that's diet. Now, most people know that ideally we should be eating healthy food every day, but we know what the reality is. Well, when we are sick, it's a different story. I would put it this way. When you are sick, the food you eat is simply make it or break it deal. There are certain foods that can help you support your immune system, and certain foods that will further suppress your immune system and make you sicker or keep you sick much longer. So let's start with the things that you should minimize or possibly completely eliminate from your diet when you are sick. My favorite is sugar, and here I'm talking about the so-called simple sugar present in candies, sodas, juices, and so on. Sugar has been found to suppress the immune system and promote systemic inflammatory reactions, which make all the symptoms of common cold worse. I'll not go into all the different mechanisms of how it does that, But the bottom line is that eating sweets while you're sick will not only make you sick longer, but it will also make you feel more miserable. Sugar will also make your body generate more mucus, and you will feel more congested, which is the last thing you want. Dairy products. While dairy products are generally considered to be good sources of calcium, and most professionals consider them to be an important part of a healthy diet, I won't go here on tangent as to why some disagree, but the bottom line is that if you feel heavily congested, avoid consuming dairy products while you are sick, especially cold dairy products. There is no major science as to why it's happening, but you can run your own experiment. Have a cup of ice cold milk in the morning and see how you feel 10 to 15 minutes later. If you get stuffed up, then avoiding dairy while you are sick might be a prudent thing to do. Now, what about ice cold drinks? Well, when we get sick, unless we are running a fever, most people feel cold and get chills. Viruses love cold environment. That's why they tend to flourish in winter. Viruses hate heat because heat destroys them. That's the basic premise of why we get fever. But more on that in a bit later. Bottom line is that you want to drink hot teas and warm or at least lukewarm temperature liquids to stay warm and avoid cold foods and beverages. Additionally, cold will also make you more congested. So, word about fever. Everybody is afraid of fever, and most people reach for Tylenol or ibuprofen the minute they start feeling only a little bit warm. But is that the right thing to do? Here is where our immediate reflex response is not the best response. Fever is actually healthy and good for us when we have upper respiratory infection. Instead of trying to suppress it, we should actually embrace it. Why is that? Simply because fever is the way our body kills the virus. As I mentioned, viruses hate heat, and heat destroys them. So in reality, we should not worry so much when we do get a fever with upper respiratory infections. In fact, we should be worried when we don't get a fever, because that's when the virus continues to multiply and make us more miserable. Fever stimulates the immune system to mount stronger response to fight the virus. Now obviously, we need to set certain parameters on when fever is actually beneficial and when it becomes dangerous. When I'm saying that fever is beneficial to our recovery from upper respiratory infection, I mean generally low-grade fever. Most professionals agree that fever up to 102 Fahrenheit is acceptable for otherwise healthy individual. When it starts to go above 102 Fahrenheit or lasts for extended periods of time, leading to excessive exhaustion and tiredness, it's advisable to lower it with antipyretics or other holistic approaches if you don't like taking pills. At the same time, if you keep on shaking and feeling cold and your body cannot mount a fever, you should help your body to induce fever. There is a very simple old-fashioned way to do it. Take a hot bath or hot shower for a few minutes, then put on several layers of clothing and lay down under the warm blankets. If you can drink hot ginger tea before you get to bed, that's even better. The goal is to slightly increase your body temperature and induce sweat. Most people also fall asleep, but it's important to get out of the bed in 20 to 30 minutes and change the wet sweaty clothes for clean dry clothes. You can go back to bed and continue resting, but do not stay too long in the wet clothes, otherwise you will get chills again and actually get sicker. Most people feel much better immediately after the sweating procedures when they wake up. In many cases, it's almost instant relief of the worst symptoms, after which things only start getting better. But be careful. This procedure is not advisable if you already have a fever or if you have been sick for a while and feel very tired. In this case, the heat could actually drain more energy from you and actually make you feel worse. It's only suitable for healthy and generally strong individuals who suffer from chills and body aches and just can't seem to snap out of it. So what is it that you should be actually doing to recover faster? We just talked about things that you should avoid, but what is it that will actually help us? What can we do to speed up the process of recovery? Warm teas and liquids. Drinking lots of warm teas or room temperature water during an upper respiratory infection is super important. Not only body uses a lot more fluids when we have fever to keep our temperature down, but it also needs extra fluids to keep the nasal secretions and phlegm in our lungs thinner so that we can easily cough it up or blow it from our nose. Not drinking enough fluids is going to not only make you more tired, but it will also make it much more difficult to keep the nasty dry cough under control. Watch our video on preparing great tasting and very effective homemade cough syrup. Now let's talk about protein. When we are fighting any infection, our body needs more protein than usual. In essence, protein from the foods that we are eating is a building block for our immune system. You can also look at protein as ammunition for the immune system. So the chicken soup that our grandmas were pushing us to eat when we were sick actually has lots of merits. In fact, soups are considered in many folk traditions around the world to be the most nutritious foods that we should be eating when we are sick. In the case of chicken soup, the meat is very soft and does not require too much energy to get digested. Some studies actually showed an increase in white blood cell count after eating chicken soup, so take it for whatever it's worth. But you can also add to your diet hard-boiled eggs and other high quality sources of protein. High vitamin C diet and supplements. I don't think that I have to spend too much time convincing you that diet high in vitamin C and other vitamins and minerals is essential when it comes to fighting infection. While I always urge my patients to get bulk of their vitamins from eating fresh fruits and vegetables, taking an extra dose of vitamin C may have some benefits. Studies don't really suggest that taking vitamin C will help us prevent getting sick. But when we already are sick, vitamin C supplements may help to decrease some of the symptoms of upper respiratory infection. I personally don't see anything wrong with taking even up to 2,000 to 3,000 milligrams of vitamin C throughout a day for a few days, and I usually take even a little bit more when I get the upper respiratory infection. Rest. Resting while we are sick sounds like common sense, but unfortunately not for everybody. I get people asking me all the time, "Doc, I have no energy. I'm completely wiped out." Well, that's because your body is telling you that you need to be in bed. The body makes you tired so that you go to bed and don't expend the valuable resources that your body needs to fight the virus. So staying in bed and getting as much sleep as possible is actually the #1 principle for successful recovery. Your body heals, repairs, and fights the virus best when you are sleeping. Part of our autonomic nervous system, called the parasympathetic nervous system, also known as rest and digest, is responsible for doing all the repairs in our body. Well, guess what? It's mainly active when we sleep. The other part of our autonomic nervous system, called the sympathetic nervous system, also known as the fight and flight response, is active during the day. When we are stressed out and do too many things, this part of our nervous system will be overactive, and it will suppress our immune system. That's why many people get sick when they don't get enough sleep and are under more stress. So here you have it. If you feel miserable while being sick with an upper respiratory infection, follow these simple rules and you will recover much faster. Understand, however, that normal progression of upper respiratory infection lasts anywhere from 7 to 10 days. Days 4 through 7 are the worst, but after that things generally start getting better. However, keep in mind that you will most likely be coughing even for 3 to 5 weeks after all the other symptoms resolve. If you like this video, please give us thumbs up and don't forget to subscribe to our channel. We will see you in our next video.